Sunday morning, and the first thing you do is prick your finger. No worries, it's just your glucometer. You have type 2 diabetes, and this is just a day in your life. You take your morning pills, metformin, aspirin, and pravastatin. It's been manageable so far. You eat right, exercise, and go to the doctor. But what happens if you also have depression? Having diabetes is stressful. It makes you twice as likely to develop depression, and vice versa. Depression can lead to bad lifestyle choices like poor diet, less exercise, and smoking, all of which make diabetes worse. My research focuses on finding depressive biomarkers in diabetes. Currently, there are no clear biomarkers for depression, making it hard to detect and treat in diabetes patients. Biomarkers are substances, usually found in the blood, which are medical signs that tell us that something is happening in your body. Wouldn't it be nice if there was a blood test for detecting depression? After all, we can't treat a problem we can't find. To identify potential biomarkers, I compared diabetes patients with and without depression. I looked at a protein called soluble epoxide hydrolase, or SEH. SEH is an enzyme that makes epoxides into diols, as you can see here. These diols are then released into the blood, where it can get carried into your brain. We compared blood samples from 20 depressed and 20 non-depressed diabetes patients to see if there were any differences in the blood. And we found 4 things. Compared to non-depressed patients, depressed patients had increased diols, decreased epoxides, and increased diol to epoxide ratios, which indicates increased SEH activity. And finally, we also found that the diols and the diol to epoxide ratios were both positively correlated with depression severity. In other words, more diols meant worse depression. Based on our findings, we think that in depressed people, shown on the right, the SEH enzyme is more active, so more diols get made in the liver. These diols then leave and enter the bloodstream and go into the brain, where they cause these depressive symptoms. Meanwhile, in non-depressed people, on the left, this doesn't happen. SEH isn't as active, so the diols don't get made, and nothing bad happens to your brain. These results suggest that diols may be a good biomarker for depression in diabetes. Inhibiting the SEH enzyme may also be a good target for depression treatment. My next step will be to look at SEH in larger populations. Diabetes is dependent on self-regulation, and knowing which patients are experiencing depressive symptoms will better address individual needs and improve patient outcomes. Thank you.